Maharashtra sees worst spike in 5 months. Fears of second COVID wave loom large. Almost 1 lakh active cases in the state. Over 1,500 cases in a day in Mumbai. Can Mumbai afford a lockdown? Maximum city, massive surge is our top focus on To The Point. A very good evening. Thanks so much for being with us here on India Today. You're watching To The Point. I'm Chaiti Narula. Today we are going to be discussing the situation, the COVID situation in Maharashtra, especially in Mumbai, the maximum city. The COVID situation in Maharashtra continues to be grim, with cases going upwards and upwards. The Maharashtra government has announced a complete lockdown for Nagpur that has cropped up as a COVID hotspot. Let's begin with this report.
Maharashtra Chief Minister Uddhav Thackeray takes the COVID vaccine at the state-run JJ Hospital. Uddhav Thackeray was accompanied by his wife Rashmi and son Aditya when he took the Bharat Biotech's Covaxin. With Maharashtra reporting 13,659 cases in the past 24 hours, the Chief Minister used the opportunity to make an appeal to fellow citizens.
याच्यामध्ये कोणतीही भीती किंवा संभ्रम मनामध्ये ठेवण्याची आवश्यकता नाही. मी स्वतः वॅक्सिन घेतलेलं आहे, तुमच्यासमोर उभा आहे आणि मनापासून सांगतो की वॅक्सिन घेताना अजिबात कळतसुद्धा नाही. एवढ्या छान पद्धतीने वॅक्सिन दिलं जाते. मला असं वाटतं मी संपूर्ण जनतेला, माता भगिनींना आणि बांधवांना विनंती करतो, कारण कोरोनाचा धोका परत वाढतो आहे. म्हणून माझं आवाहन आहे की सर्वांनी ज्यांना ज्यांना आता वॅक्सिन देण्यासाठी पात्र ठरवलं गेलेलं आहे त्या सर्वांनी मनात कोणतेही किंतु परंतु न आणता वॅक्सिन घ्यावं.
The Chief Minister warned that lockdown could well be a possibility if people didn't abide by COVID norms. The government has already imposed a lockdown in Nagpur from the 15th of March till the 21st of March. Industry and essential services will, however, remain open during the lockdown. Government offices will function at 25% capacity. The restrictions come even as COVID numbers rise in the Vidarbha region.
नागपुर शहर में बढ़ती हुई तेजी से कोरोना बाधितों की संख्या 15 मार्च से 21 मार्च तक के शहर में पूर्णतः लॉकडाउन घोषित किया जा रहा है.
Mumbai, Thane, Pune, Nagpur, Amravati are amongst the worst hit COVID hotspots. On Wednesday, Mumbai recorded 1,539 cases, taking the total number of active cases to 9,973. Thane recorded 10,460 COVID cases. Pune had 18,474. Nagpur 12,724 and Amravati recorded 5,259 active cases. In Mumbai, the Brihan Mumbai Municipal Corporation has asked residential societies to inform them of COVID norm violators. The city has 25 active containment zones and 229 sealed buildings.
आज इसको सेकंड वेव तो नहीं बोल सकते, लेकिन अपन सेकंड वेव के नज़दीक है ऐसा डेफिनेटली बोल सकते हैं. और इसमें अगर इसको लॉकडाउन या सब चीज़ें रोकना है तो एक ही चीज़ होना चाहिए कि हर आदमी ने अपना मास्क पहनना चाहिए और जो अपन क्राउड करे वो क्राउड नहीं करना चाहिए.
While Mumbai and Maharashtra is carrying on with the vaccination drive, the rising number of cases have become a big concern for the state government, with the members of the state COVID task force also indicating that if the cases continue to rise, then soon there could be a discussion on whether the financial capital also needs a complete lockdown. With camera person Mahesh More, this is Pankaj Upadhyay in Mumbai, reporting for India Today.
Let's get you the COVID curve in Maharashtra first up, and questions now arising on whether the maximum city of Mumbai needs a lockdown or not. In Nagpur, you've got lockdown between 15th March and 21st. In Pune, you've got schools and colleges that are completely shut at the moment till 14th of March, and there's also a night curfew in place. As far as Thane is concerned, which is right next to Mumbai, it's very close by, there's a lockdown in 16 hotspots till 31st of March. As far as Nashik is concerned, there's a partial lockdown from 9th of March, and no big gatherings are allowed at the moment post 15th of March. Aurangabad, there's a partial lockdown till April 4th and a complete lockdown over the weekends as well. I'm being joined on this broadcast by Dr. Shashank Joshi, COVID Task Force member from Maharashtra, Dr. Prateet Samdani, internal physician and a renowned physician while at it when it comes to coronavirus. Nitin Raut, Maharashtra Energy Minister as well. Sahil Joshi reporting from Mumbai. First up, let's take this straight across to Dr. Prateet Samdani. Dr. Samdani, what is going on in Maharashtra and what is going on in the city of Mumbai? Why are we seeing such a surge? There's also a fair amount of talk of Mumbai going into a lockdown. Do you feel it is necessary?
Thank you, Chaiti. Yes, Mumbai is going through what I would call as a beginning of a second wave. And we must remember, waves in a sea are never preceded by, they're always preceded by troughs. So we've had a trough, and now we're actually seeing a wave. And the analogy is that we often don't think about it or talk about it. So we need to be extremely watchful. Mumbai, certainly since October 21st, 2020, has seen the highest number of cases, amounting to 1,539 odd cases. And I think the real reason is, of course, because of the callousness of the people of Mumbai and the state and the country. Trains opening up, offices beginning, some schools beginning too, gatherings in terms of marriages, political rallies. And I would not blame the Mumbai Kurd to being lax and not being COVID-proof. And I think this is time that we Mumbai Kurds and the countrymen also start behaving as the way we did right in the beginning. So Mumbai is going through a surge. This is like a second wave, although it's not as big as the second wave that we saw in September and October. And if things do continue like this, we may well see more disciplinary action from the government.
Hold on to that particular thought right there. Dr. Prateet Samdani has very well elucidated all the reasons why Mumbai is seeing this particular surge and why the problem arises in Maharashtra as well. Dr. Shashank Joshi of COVID Task Force, he's a member of the Maharashtra COVID Task Force. He's also joining us on this broadcast. What is the COVID Task Force doing at this point of time? How does one contain this? What is the solution now?
So there are three things we need to do ASAP. Number one is, we are seeing these large numbers predominantly because we are testing more with RT-PCR. And Mumbai was testing just a couple of weeks back, not even 5,000 cases. And now we are every day testing more than 20,000. So if you see the test positivity rate, it is hovering around 5%. Yesterday was the only time it went up to 7%. So if you see on a pure test positivity rate, Mumbai is still doing reasonably well. Recovery rate is more than 90%, death rate is very low. So death numbers talk. So actually but the challenge is, I agree with Prateet that we need to have COVID appropriate behavior. People think Corona is over. That's not true at all. And also what is very, very interesting to find out is it is not the lower socioeconomic strata. It is not Dharavi. It is not the slum which is reporting COVID. It is being reported predominantly from the middle class and the neo-rich class. And that is a worrisome sign because people who are not exposed, they are the ones who are getting exposed and getting the disease. Though it's a milder disease, it is a different sort of a clinical presentation. Many people are getting even gut symptoms and not the typical fever, dry cough and other symptoms. Also, the disease is milder. Though the private ICUs are getting fuller now, the public health infrastructure is reasonably empty. So that is also a reassuring sign. Mumbai did see unlocking of trains. It also saw unlocking of everything. And we will go for micro containment. I don't think lockdown is a solution at all. And we'll need to do three things. Number one, increase our contact tracing to 1:30. Number two, our asymptomatic. 80% of people are asymptomatic. And they find it very difficult to stay at home for 10 days.
So, Dr. Joshi, there's a very important point that you mentioned that for Mumbai, lockdown at the moment does not seem to be a solution at all. And of course, it has economic repercussions as well, but I'm not getting into the economic repercussions of it. Staying with the medical side of it, Dr. Prateet Samdani, are you in agreement that there is no requirement of a lockdown, but just the citizens just coming together and making sure that they are vigilant about their protocols, and that perhaps could be the solution. Is there anything to panic about? Because even the Chief Minister at this point of time in Maharashtra is mulling for another lockdown in Mumbai. Would you say there's enough reason to panic?
I think there's enough reason to think about why this is happening rather than panicking. So we do need to get our shoes on and we need to be watchful. We don't need to panic. Tracing, quarantining for 14 days. And as you know, Dr. Joshi was saying, the most patients are asymptomatic. And often enough, they don't get tested or the medical care practitioner doesn't ask them to do the test. And thus, these are the ones that can actually spread the COVID infection. So I think it's imperative, if you have a symptom, you must get yourself tested and religiously and honestly quarantine yourself for those 14 days to prevent a further spread. So no lockdown at the moment in sight, but clear-cut, open eyes and wide eyes to make sure that things are under control.
So both the doctors on the broadcast are of the opinion that a lockdown at the moment is not necessary. Taking this across to Sahil Joshi as well. Sahil, there is some amount of talk that is going on in the Maharashtra state government about there perhaps being a lockdown that is perhaps can be imposed in Mumbai. You can see already partial lockdowns being implemented in other parts of Maharashtra as well. What is the state's government's stance as far as the COVID crisis in Maharashtra is concerned? Because the numbers are rising. More than 13,500 cases in just 24 hours itself is a matter of huge concern at the moment for any government.
Well, Chetty, I was listening to Dr. Shashank Joshi and I somewhat agree with him because the number of tests have definitely increased. But, I will surely quote some numbers, which will show that this time Mumbai is not a hub of the COVID cases the way it was last year. During the same time, April, May, June, we saw that Mumbai numbers were soaring and it reached to its peak in around August, September. Right now, the numbers what we can see is that on 11th of February, Maharashtra had 36,917 COVID active cases, whereas now, exactly after a month, on 11th March, Maharashtra has 1,240,000 COVID active cases. But the top of the chart is not Mumbai. If you look at the numbers, Pune is topping the chart of active cases, around 18,000 active cases in Pune. After that, it's Nagpur and the adjacent areas of Mumbai like Thane are topping the chart. But what is worrying right now is that out of 10 cities, if you look at India, out of 10 cities where the number of active cases are maximum at this point of time, 8 cities are from Maharashtra, and that is something which the government is worried about. Now, what the government has done, now what the government has done is that rather than going for a decision which will affect the whole state, rather than going for complete lockdown or a decision for the whole state, they have equipped the district magistrates, the collectors and the local administration to take decisions with respect to their own city or the area. So that's why what we can see now is that the Nagpur has gone for a complete lockdown from 15th of March.
So there is fair amount of management and micromanagement, and they've empowered the local authorities to take these decisions as well. Now the question really comes, and I'd like to take this with Dr. Joshi, who's on our broadcast. He's from the COVID task force. Are we vaccinating enough? Is there a problem? Are people feeling shy of the vaccination due to the side effects that are being reported, or what is going on the vaccination front? Because perhaps that is the only solution to cut off this transmission at some point.
So you are absolutely right. We are putting vaccination on fast track mode. In fact, we have suggested 24/7 vaccination. Even today vaccination was on. So it is a holiday. So 24/7 vaccination we have suggested. We want to cover the most vulnerable group as early as possible. And once we are done with those numbers in a month or month and a half in Maharashtra, then go to the next level. So I think that's absolutely critical. We have also suggested, like Rajasthan, if government of India allows Maharashtra government to vaccinate people at home, because there are a lot of people who cannot come to the vaccine centers and who are critical and cannot, they are incapacitated, they are immobile. So we have even suggested that. So I think we are trying, and we are also trying to run an information, education and counseling campaign for people to come forward. And that's the reason the Honorable Chief Minister took this Covaxin shot today and he's trying to encourage people to go and vaccinate.
All right.
So I think
Apologies about
people-
that interruption right there, but Nitin Raut, who is the Maharashtra minister, is now joining us on this broadcast as well. Mr. Raut, is your government, I believe, is planning a lockdown for the city of Mumbai on the back of the rising COVID cases, but Dr. Prateek Samdani, who's on our broadcast, and Dr. Joshi, both are of the opinion that a lockdown is absolutely unnecessary at this point of time. What is your government's stance on this situation?
It's okay if doctors are telling like this. This is to be considered. Lockdown is not a measure for this COVID-19, but the people vulnerably moving all around the places, and they are not using mask, and they are not making distance, keeping distance, and washing
That is
hands.
the implementation of the set protocols that the ministry has brought forth, right? The people perhaps need some level of policing on that front as well. And Dr. Prateek Samdani was making a very interesting point earlier. He said we all have to be responsible ourselves, and somewhere also it becomes the state government and the police's responsibility to ensure that all of that gets implemented, isn't it, Dr. Samdani?
No, we are not
Absolutely.
the dictators. We are the democratic peoples. We are requesting peoples to do that, but peoples are not helping us.
Absolutely.
In that case, what we will do it?
Exactly. Dr. Prateek Samdani?
Yeah, so God helps them, those who help themselves. I mean, you do not want to be at a risk of carrying COVID-19 infections to yourself, to your parents, to your siblings, your kith and kin. So I think every citizen here, irrespective if you've had COVID in the past or no, should be responsible enough. Hands below the basin, masks above the nose, and physical distancing as much as possible should be maintained. And I reiterate, this is here to stay. This needs to be continued. No form of laxity. Of course, the government policing.
And we have 30 seconds left on this broadcast. Dr. Samdani, one word on the vaccination front. What is your message going out to the people in Maharashtra as far as the vaccination is concerned?
About 4.76 lakh people have been vaccinated in the city, and about 2 million in Maharashtra. I think for the people who are fearful of vaccination, there is no vaccine for the stupid. If you can vaccinate your pets and your children, you dare not feel frightful of vaccinating yourself. Go there, get your vaccine shot. A public-private relationship is the best way to vaccinate masses.
All right, so vaccination going forward, it seems to be the solution. I thank you very much for taking the time out. Dr. Shashank Joshi, Dr. Prateek Samdani, Nitin Raut, Sahil, of course, reporting from Mumbai as well. That's it from me on To The Point. This is Shweta Narula signing off.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.